Dipsomania. What is dipsomania? Dipsomania is an old clinical term historically used to describe an uncontrollable craving for alcohol. Unlike casual drinking or even heavy use, dipsomania was characterized by sudden and irresistible urges to consume large amounts of alcohol, often in binge-like episodes. Today, the condition is more commonly understood under the modern framework of alcohol use disorder, AUD. Historical definition and usage. The term comes from the Greek dipsa, thirst, and mania, madness, reflecting the uncontrollable thirst for alcohol. It appeared in medical literature in the 19th century, when doctors attempted to categorize alcoholism as a disease rather than a moral failing. While dipsomania has largely fallen out of use, it played a key role in shaping modern addiction medicine. Symptoms and behavioral patterns. Those described as dipsomaniacs were known for sudden bouts of excessive drinking, sometimes after long periods of sobriety. Symptoms included loss of control, inability to stop once drinking began, and harmful effects on health, relationships, and work. The pattern often repeated cyclically, with binge phases followed by temporary abstinence. Examples and case studies. Historical reports often cited individuals who lived respectable lives for weeks or months, only to suddenly fall into days of uncontrollable drinking. These binges frequently ended in illness, debt, or criminal behavior such as public disorder. Modern parallels can be seen in those with severe alcohol dependence marked by cycles of relapse and binging. Causes and risk factors. The causes of dipsomania were debated historically, with theories ranging from genetic predisposition to moral weakness. Modern research highlights biological and psychological factors, genetic vulnerability, altered brain chemistry, trauma, stress, and coexisting mental health disorders such as depression or anxiety all play significant roles in alcohol dependency. Diagnosis in modern psychiatry. Today, dipsomania would be classified under alcohol use disorder. Diagnosis relies on patterns of impaired control, risky use, social impairment, and physical dependence. Clinicians use tools like the DSM-5 or ICD-11 criteria, along with screening instruments such as the AUDIT, Alcohol Use Disorders Identification Test. Treatment approaches. Treatments for alcohol dependency include detoxification, rehabilitation programs, psychotherapy, and medication. Cognitive behavioral therapy, CBT, motivational interviewing, and group support, such as Alcoholics Anonymous, are widely used. Medications like naltrexone or acamprosate may help reduce cravings, while inpatient care is sometimes necessary for severe cases. Punishments and legal implications. Historically, dipsomaniacs often faced legal consequences for alcohol-fueled offenses, such as disorderly conduct, assault, or neglect of duty. Today, while addiction is recognized as a medical condition, alcohol-related crimes are still punishable. Courts may sometimes order rehabilitation or treatment programs instead of prison sentences, especially when public safety is not severely threatened. Mental health and social impact. Beyond legal issues, dipsomania, or modern alcohol addiction, has profound effects on mental health and society. It increases risks of depression, suicide, domestic violence, and accidents. Families often suffer from instability, while healthcare systems bear the burden of treating alcohol-related illnesses such as liver disease, cardiovascular problems, and neurological damage. Why dipsomania still matters. Though the term itself has faded from medical use, the concept of dipsomania remains significant in understanding the history of psychiatry and addiction studies. It marked a shift from viewing alcoholism as a sin to recognizing it as a disorder requiring medical and psychological intervention. Today, studying dipsomania helps trace the evolution of how societies view and treat substance abuse.